Hi, everyone. My name is Ruchi Shah, and I'm a family medicine and addiction medicine physician. I currently work in the Bronx, New York, in both the outpatient clinical setting, where I provide primary care, including reproductive health and addiction medicine, and also work on an inpatient addiction medicine consult service. I'm passionate about partnering with people who use drugs in their care through a person centered approach. As someone who strives to turn our big feelings into meaningful change, I'm excited to talk to you about how to access the life-saving medication naloxone. While naloxone has been approved by the FDA since 1971, it was not accessible to those who could benefit the most. Folks who use drugs are very often the first responders in reversing an opioid overdose. We can't talk about naloxone access without honoring Dan Bitt, founder of the Chicago Recovery Alliance, who was the first person to make naloxone truly accessible by getting it into the hands of community members, resulting in countless lives saved. In a study of 385 US participants given naloxone at a syringe service program over a 15-month period, 74 reversed an overdose and 50 returned to request a second dose. Naloxone distribution and training to bystanders who are likely to witness an overdose, so this is friends, family members, and partners of people who use drugs, are similarly skilled as, and I would personally argue often more skilled than, medical professionals at recognizing an opioid overdose and knowing when naloxone is indicated. The FDA approved the first intranasal naloxone 4 milligram for non-prescription over-the-counter use in March 2023. This was followed by the FDA approving the second intranasal naloxone 3 milligram dose in July 2023. However, there remain multiple barriers to accessing naloxone. Naloxone, while available over the counter, is not free, and so it may be cost prohibitive to many. A prescription for naloxone can help eliminate the cost barrier, as most private insurances, Medicaid, and Medicare cover the cost with a $0 copay. It is also important to prescribe 11 refills so that patients may access additional naloxone whenever they need it. If you're buying naloxone, you can see if your pharmacy stocks the 3 milligram intranasal naloxone, which is a compassionate overdose reversal agent, which is typically more affordable in cost. If you're buying 4 milligram intranasal naloxone, the generic brand may be more affordable than the brand name. Your local Department of Health may also be a resource in accessing naloxone. They may provide a list of community programs that offer free naloxone. Some states have public health vending machines that dispense naloxone, and the Department of Health website will have these locations. Additionally, the Department of Public Health may have options for free or affordable naloxone available via either delivery or pickup at certain locations. Accessing the pharmacy to get naloxone may also be a barrier to some individuals and certain communities for a variety of reasons. These reasons may include lack of insurance and transportation, and also stigma, which may result in folks feeling unwelcome and facing discrimination in these spaces. Providing take-home naloxone in hand increases access compared to prescription naloxone, even when there is a co-located hospital pharmacy. In a study that compared naloxone prescription to take-home naloxone kits in the emergency department, they found that only 14% of scripts were filled at a co-located hospital pharmacy on discharge from the emergency department. Check with your pharmacy to see if you can partner and collaborate to provide take-home naloxone in your clinical setting. This can be pharmacy-led, physician-led, or nurse-led. Here are examples of one institution's take-home naloxone policies in each of these settings: the emergency department, the inpatient setting, and the outpatient setting. Naloxone can be delivered to you. Next Distro is an online and mail-based service for people who use drugs, and you can go to their website and enter your address to have naloxone mailed directly to you. Another way to access naloxone is at your local syringe service program. Next Distro has an interactive map where you can select your state to find your local community organization that carries naloxone. And lastly, remember to always carry naloxone. One tip is to have it in your most commonly used bags so you don't have to worry about remembering to transfer it. You can also keep naloxone in a place that you'll see it right before you head out, such as next to your keys. And remember to restock your naloxone if you use it. Our communities are safer with naloxone in as many hands as possible. To summarize, the community of people who use drugs have always led the way. Naloxone is available over the counter, but may be cost prohibitive. And so it is important to prescribe naloxone to make it more affordable and also prescribe it with 11 refills. Naloxone can be mailed directly to you via the Next Distro website. Take-home naloxone may increase access compared to prescription naloxone. You can partner with your pharmacy to make take-home naloxone available in your clinical setting to give in hand. And remember, always carry naloxone.